My name is Ann Kelly, and I'm the mother of 3 children, 2 of which have recently been diagnosed with a mental health condition, bipolar 1, with anxiety. The journey of my 2 has been different, but interestingly enough, they've both been diagnosed with the same disorder. My daughter's journey was one where she was a happy, healthy, stable child who, through her adolescence, had many friends, very athletic, great student, and we proceeded with her going into high school thinking all would be well. She hit high school and the pressures of a high-achieving high school. She started to show signs of anxiety, but we just passed that off as that's a natural part of being in a high-achieving school with lots of social pressures, etc. And she managed to get through her high school years without any indication of any mental health condition. We sent her off to OSU and the honors program, pre-med track, and academically she continued to be a high achiever. But the social aspects of a Big Ten university led her to feeling heavy anxiety. So she came home for her summer break, and it was clear that the anxiety had gotten the best of her. And as the weeks proceeded, she then started showing signs of depression. So I made the assumption that it was just a situational depression. We went to our primary care practitioner, and they prescribed an antidepressant. And unfortunately, the diagnosis was wrong, and that antidepressant threw her into an extreme mania. So we had to hospitalize her, and in the care of the Lindner Center, they were able to identify that she was bipolar 1 with anxiety, and that an antidepressant was not the right medical choice. We have now been able to provide her with the correct medical care, and she is back to school and succeeding as a junior at Ohio State, and coincidentally, she's changed her major to neuroscience. My son, on the other hand, as a child was diagnosed with ADD and then depression, and so he had been treated for many years with a psychologist, and his events that led up to his acute episode were we missed the signs of his lack of sleep, his nutritional choices, his very overt change in social behavior, testing the limits with drugs and alcohol, not being able to attend school on a regular basis, and we just felt as though he was being that typical high school junior who wasn't really behaving, and we should have known that those were signs of a more deep-seated mental health issue. When his crisis hit, we were brought to Children's Hospital, and luckily for him, based on our experience with our daughter, he was quickly diagnosed with the same disorder and effectively treated with the same medicine, and he is now back to school within 5 months of the event, and we're pleased to say that he seems to be stable and functioning at a normal level.